Hi guys, my name is Chandra. This is my mother Cindy. We are at the Sacramento airport right now. We are heading to Fort Myers, Florida to go see Dr. Hauser. Wish us luck. Georgia. Next stop, Fort Myers. We are here at the Heart of Palms Ranch and Eco Farm in Lehigh Acres, Florida. We got in late last night, so we're just soaking it in today. I'll show you guys around.
Got a banana? That's crazy.
The edible garden. Papayas, mangoes, bananas, as you saw. What is it? Show it. Whoa. Whoa. I'm sure it's edible. Whoa. It's like a weird bell pepper
like a
pomegranate.
Sweet.
Sweet? I am getting my very own fish pedicure at the farm. Enjoying a dip in the hot tub before Mom has her Prolotherapy in the morning. So I'll see you guys then. Bye. Good morning. It's 7 o'clock, which feels like 4 o'clock to me, California time. We are on our way to Caring Medical for Mom's appointment, so we'll see you guys there. Bye. This is Rachel. She makes everything happen here at Caring Medical.
You're very sweet. Hi, how are ya?
That's what's going to be happening to Mom's neck in about an hour. We are here somewhere in Florida. But this little guy, it's us. Placerville, California. Hawaii.
Where'd I go?
Renee's ready for treatment.
Come from all over. Kathy, do you mind explaining what you're doing right now?
I am drawing her PRP. So our platelet-rich plasma. And we're going to use that for her neck. I draw 2 syringes. Almost there. And get a little squeeze, just hooking up the nitrous mask.
Mom took pre-med 1 Xanax, and she will get her nitrous when the doctor comes in.
Just a little oxygen coming at me, okay? Okay, let's get this heat pack out of the way. Okay. I was just told we could go ahead and start.
Oh, it's in the
Yeah. So I'm going to go ahead and start your nitrous. So here we go. So Doc, Cindy was telling me that, it's been a couple months since we treated her. And for a couple months after each treatment, she'll usually, or like 2 to 4 weeks, she'll feel better as far as all of her symptoms. The one thing that has remained good is her nausea, and her appetite have improved and stayed good. But after that 2 to 4 weeks, and during that time when she's feeling better, she does admit she's probably overdoing it during that time. Sleep is poor, and she's really kind of struggling with what position, because she ends up on her stomach, whether she knows she's on her stomach or not, in the middle of the night. And she knows that can be pretty bad on the neck.
Big bucks for this podcast. Okay, so the jugular vein and the vagus nerve, they go into the same hole into the brain, the jugular foramen. So the obvious here, what we do is we do a lot of measurements of the jugular vein, primarily in this region.
Yeah.
Because
whatever's going on in the jugular vein is also happening to the vagus nerve, because they go in the same hole, so they're right next to each other.
That's
So-
I get a lot of my pain right here
So
too.
let's just say, for argument's sake, you had a double twin of you. So you have a twin of you. One of the twins, they just happen to sleep in a position, like let's just say the right side, and everything's open. Like the jugular vein's completely open, the vagus nerve is thus not under tension. Then that twin has so many less symptoms than what you would have because you sleep on the left side and don't realize you have maybe a little bit of a styloid, and when you turn your head to the left, so when you're sleeping, you're on the left side. You turn your head to the left, and you don't realize, but all night long, you just happen to choose a position that the other twin didn't. So
I do that a lot.
Right. So what we're gonna do for you, so you might want to record that today, like have Sis or somebody record when you're getting your IJB study, because we use so many different positions.
I'm doing the DMX today too. So. Oh, and one more thing. I made you a gift.
Oh, that was nice. It's beautiful. Thank you so much.
Turn around, show the camera, hold it up.
I could even,
No, you
I don't wear it.
turn it around. Flip it around.
Turn that around. There you go.
Did you wear it?
He was trying.
There, hold it like that.
Like
there
I
we
could
go.
wear it. Maybe that's what we should do. Like, we should make.
No, it's not a beard. It's to hang on your
No,
wall.
you do it on
It's
your
a
chest.
macrame.
Oh, see, I already broke it. See, you don't
You
want
broke
me-
it.
I already broke it.
Well,
See,
see,
I've had it.
now you
I've
can
had
put it around your neck.
Yeah, I've had it. Oh, there you
There
go.
you
There you
go.
go. See, like if it was a little bit
It's not a
bigger,
bib. Oh my gosh.
then
I'll get
people-
to watch it later.
No, then people.
We could attach a little clip on
No,
it.
come on. Like we could have these. I wear it. Then like it could be a YouTube sensation.
All right.
Yeah, and then you'll get orders from all over the globe. Like, no, but we have to come up with a name. We have to come up with like a certain kind of a name.
Well, I was hoping
what
you
are these
could.
normally called?
They're just that it's a macrame. You should hang it somewhere in the office
Macrame wall hanging.
or in your house.
So macrame.
Macrame, yeah.
Yeah, it doesn't seem very interesting, but that's okay.
How many times have I heard this story in 23 years?
Does he ever change the story?
That's what I was
the
thinking
question.
of. How many times?
Easy does it. Good job, Mama.
You liked me when I didn't have a voice earlier in the week.
Yeah. What do you think of people who laugh at their own jokes, you know?
I think I'm funny.
Thank you, Sandra.
I feel like I have less flow on my oxygen or something. Or my, is it flowing okay?
It looks like it's flowing okay. It's giving me appropriate numbers.
Doing
Let
great.
me just make sure there's no kink in here, okay? Since you moved around a little bit. Make sure that there's...
You look like you've gotten in shape. Have you been working out more?
No, I'm just wearing spandex.
I know, but how's your activity level?
Good. Probably too good. I was doing like gymnastics choreography, like dancing with the girls.
That's what I mean, yeah.
And I was like swinging my head around in the dance. And dude, I almost swung my head off. I swear to God. My neck was so messed up that night. Just too much movement in my in my neck. Good job. Wow, good job. You're like halfway done already.
Doing amazing.
You want PRP next? Just keep on Prolo.
PRP. the kids have a show coming up?
We're actually in competition season. They just had their state championships.
How'd that go?
Really good. They all qualified to regionals.
Awesome.
Yeah.
Check, man, that's amazing.
Yeah.
That's amazing.
Yeah.
You should be
I am
proud.
proud.
I need a proud of yourself.
I need a raise.
I'm gonna put some ultrasound gel on, okay?
Well, the must give you great joy.
Use a
Just
little break for a minute.
okay.
Fine.
For a second.
Just gonna like.
And you must give you a lot of joy just to see the kids so happy.
Yeah, it does. Do you want to explain why you use the ultrasound?
Yeah, we'll show the.
Okay.
Good job, Mama.
Yeah, careful pushing yourself up too far because you're gonna fall off the end of the table.
Well, that's okay. We can adjust this. Do you want us to adjust it?
Yeah.
And we can move this up if you want.
No,
or-
she wanted it down.
Okay.
Do you want that moved?
Anyway, looks good to you.
What's that?
Whatever looks good to you.
Okay, this is fine. Yeah, maybe just hold it.
Yeah.
Okay, so that's the occiput, that's the atlas, that's C1, C2. And we just gotta make sure that where the needle's going in, there's not the vertebral artery. So see if I went right there.
Mm-hmm.
So if I followed this trajectory, there's no vertebral artery. But if I went over here, so see I moved the ultrasound probe. See, I went over there.
Mm-hmm.
So we're just got to make sure that Mama, that the. Okay, so that's gonna be fine.
Okay, I'm just gonna hold this here, okay?
So you can see the needle going in. See that? See the fluid.
Yeah.
Going
Mm-hmm.
in. If we want to see the fluid, like just to see. Maybe, see, that's the fluid going.
Good
You
job.
Saw that. Yeah. You're okay. You're amazing.
Emma?
No, it's okay. See the fluid going in.
Mm-hmm.
See, so you can see that the PRP, it just goes all throughout the joint, around the joint, the ligaments. It's going to cover everything. Mama, you okay?
Mm-hmm.
Yeah.
Almost done. We'd be done, but your daughter keeps asking a bunch of stuff. See how the sides are different? See how this side, the anatomy is a little bit different.
Yeah.
So that you saw that artery over there. So the occipital neuralgia is on what side?
Oh, I don't remember. Which side is your occipital neuralgia?
The right.
So you can see just from the vertebral artery.
In there, you're almost done. You're doing great.
Oh.
Very good. Some more.
Good job.
Right shoulder as far down as you can go. And mouth slightly to the left a little bit. And then chin up a little. Chin down a tiny bit. Good. And then left ear to left shoulder. Good. And then right ear to right shoulder. Good. And then left ear to left shoulder. And mouth slightly right. Good. And then right ear to right shoulder. And chin down just a tiny bit. Good. And then left ear to left shoulder. and mouth slightly right. And then chin down a little bit. Good. You can relax. Well done.
After procedure update, we are back at our Airbnb. Mom is relaxing in bed. She just took a bath. Her procedure went smooth. Everything was good. The whole procedure typically lasts between 10 to 15 minutes from the start of injections. We do a pre-med of Xanax, and we also get the nitrous gas. Both help a lot with the pain and just being able to relax. If you're someone like me, I get the worst anxiety. I still do. I also want to note that this is not our first time. Tomorrow will be my 7th treatment. But I still get super anxious, so it really does help a lot. I showed a snippet of the Prolotherapy solution and the PRP. So we get both. The PRP really helps with our nerve pain in our neck. We've noticed the most relief when we combine them both together. So that's just what works for us. The nurses there, all the staff are incredible. They're caring. We love them all. I've had probably about 4 or 5 different nurses throughout my time. Dr. Hauser, he's great. He's a character. Really lighthearted. So tomorrow it's my turn. I'm basically getting the same exact procedure done. So wish me luck. See you then. I also forgot to mention, the footage of me is the DMX x-ray, digital motion x-ray. Basically what diagnosed me with the cervical instability. As you can see in the video on the screen, when I'm tilting my head, you can see, if you look closely, you can see the top of my C1, how it, when I turn, it overlaps on each side, that really pointy, sticky bone. So I can tell just by looking at the video that I'm still pretty unstable. So the PRP helps tighten the ligaments to hopefully in the long run hold my neck in place so my head's not falling off my body. So yeah, I just wanted to throw that in there. So that's what's going on. It was kind of like my checkup. So sometimes if you do your first appointment, the first one's a lot more in-depth. So that was kind of like a mini DMX just to check up on kind of where I'm at with everything. So I think that's all. Oh, I'm also going in a couple hours back in to do a kind of like a sleep study. So they basically look at different sleeping patterns. I'm a really bad sleeper. I sleep on my side, my back, my stomach. I roll around in my sleep. So basically they see in certain positions if your nerve or your jugular vein is getting impinged or pinched off, depending on how your head rests or your neck, basically. So we'll see how that goes. It should be interesting. Good morning, fellow zebras and whoever found interest in my video. Morning of my appointment for my prolo on my neck. I figured I probably don't need to record it because it's just going to be the same thing that my mom did. Unless you are into needles and bleeding and pain, then that's cool. Good for you. I'm not. I will be recording my DMX and my sleep study when Dr. Hauser goes over it, hopefully today before my appointment, talking about the results. So hopefully he does that and I'll upload that for you guys. But yeah, I don't really think it's necessary to watch me go through my pain. Plus I don't handle it as well as my mom does sometimes. So yeah, I'm nervous. I get nervous every time. So I'm also anemic. Well, I'm becoming more anemic again. I have a stomach disease called ulcerative colitis, and I had been in a flare the last couple weeks. So I am a little nervous for her to take my blood. Plus, I just started my period last night, so it's like the cherry on top. So, yeah. But I'll be good. I'll update you guys later. I'll probably really, really messed up, but I'll do my best. Bye. Prolo. That's my PRP bud and numbing agent.
Dr. Hutchinson, bringing 13.
Okay, so your curve, it's still pretty straight.
Yeah.
So you have to do computer stuff for now. Okay.
I've been working on it, but I do need to do it more. I'll admit.
Okay. So most people, they know, you're supposed to have your chest out, and most people, they look down at the computer.
Yeah.
They look down at the computer. So I want you, well, here, I'll show you. I'll show you when you do this. So let's agree. You can see, you still have a little bit of a reversal of the curve. So if you look at this, so basically there's still a little bit of instability. Yeah. I mean, just a little bit.
I think it's better than the last time.
It's really just mild. So all this stuff is mild. You can see if you draw a line here, there's just a little bit. So, just a little bit, but okay. So let's look at this. So now you're looking straight. Let's watch this. Okay, so you're just a little bit. See how you're just a little bit and you're starting to get a curve?
Yeah.
Then, so right there, see how the atlas is now by C6 if you draw a line.
Mm-hmm.
So long story short, so in the ideal setting from an exercise standpoint, you would be like this. Whether you just do this as an exercise, to strengthen your neck, or you have your computer set up high.
Okay.
So, if you came to my office, you'd see, I'm in a regular chair, and then I have something on my desk that can raise or lower the computer. You'd be like, geez, Doc's got his computer pretty high. Everybody's different. You may have to start out where it's just a little bit high, but if you just do that, you'll have a really good neck curve. Okay. You can see what beautiful anatomy you have.
Yeah, I think it's definitely better than last year.
If you think about it, can somebody totally get better with prolotherapy to tighten the ligaments if hours a day they're like this? So we just live in an age where more and more to get better, it's what you do. It's actually what the person does moment to moment, day by day.
Yeah.
Because of the YouTube channel, I have patients now coming in that have already taken it to heart to work on their neck curve. Yeah. And I'll bet you in a year or two, I'll have definitive evidence that they need less visits. Because
they're doing their part.
Well, no, they come in without such a bad cockamamie curve. Yeah. They've already done some work. So the ligaments are already in a shortened position. Yeah. Instead of being you have that reverse. Say you came in like this. Then, but you were having symptoms when you're upright and you're with the girls. And you're training them, and you notice, you get pain or dizziness or this or that. Because there are going to be times, where you got to look down and do some work. Yeah. So, but because you have a good curve, it's probably going to be less visits because when you are in the neutral position, the weight of the head's here. But if you have a straight curve, the weight of the head's in front of the curve, which is going to strain the ligaments. There's more force on the ligaments. So why don't we agree, before I see you again, you got to get at least a little bit of a lordotic curve.
Okay. Yeah. I'll work on it. I have my weights.
If you need me to, write a script for it to get an X-ray back home, I'm happy to. so far everything's mild.
Okay.
Yeah. Always remember too, just because Dr. Hauser said there's mild instability doesn't mean that the symptoms have to be mild.
Yeah.
You know,
Everyone's
everybody's
different.
anatomy is different. So just because I say somebody's instability is mild just basically means that if you get your curve good, it's just not going to be a lot of visits
Yeah.
of prolotherapy to resolve the rest of it. That's basically all it means. But you could have kinking of the vertebral artery and have horrible vertigo just from a little bit of C1, C2 instability.
Yeah.
105.
And if what would you say is still your main symptom?
Up top.
Pain.
Neuralgia.
And then I could tell your pupils are dilated a little.
Well,
Do
it's
you have light sensitivity?
yeah. Well, my vision is all sorts of really weird. So I still get really bad, like anytime I stand or move, or even when I go to sit on the toilet, it's in my eyesight like that, really bad.
On both sides.
Yeah.
Okay, so we'll talk about that. That could be.
That's the one thing that hasn't changed or gotten better. What is the throbbing in my eyesight?
Both sides.
Yeah, and I can feel it like pulsating in my neck as well.
Please call 105. Sandy, 105.
To me, the right side looks better than when I first came, but the left side still looks.
Oh, okay. The other thing too to remember is when you don't have the curve lower down, it puts strain on the upper part. Yeah, I see what you mean.
Yeah.
Yeah, the right side is
Definitely.
holding a lot better than the left. Okay. And then that sort of makes sense. Like everybody has a hub of what's causing the thing. Like everybody has a main problem. So that's always the last thing to get better. So we'll just agree I'll do most of the PRP and stuff on the left side.
Yeah, like the left looks pretty similar to when I first started, I'd say.
We'll measure it and we'll see. You might say, well, why is that? Well, are you right-handed or left-handed?
I'm right-handed, but in gymnastics, I used a lot of my left side of my body first, so.
But, well, like if somebody's right-handed, they tend to go to the, right, like they go to the right.
I mean, I don't write a lot. I don't work in an office or anything, so, but.
Okay, so let's look at the rest of this.
So this is the sleep study.
Yeah. We'll give you the reports and everything.
Okay.
These are just the results, but the reports explain all this. But look
Okay.
at when you lay down on your right side, 80 millimeters squared. So that means your jugular vein at C4, C5 is basically totally open
That's
on the
good,
right when
yeah.
you lay down. And then at C1, C2, it's still pretty open at 54.
Is that just laying on my back?
Just laying on your back.
Okay.
Then on the left side, though, notice here, see how constricted it is at C1, C2?
Same position.
On the left side? No,
Right, on
this
the-
is
yeah,
this.
just laying down, like on your back.
Okay.
No, it just shows you even this, it's on your more unstable side.
Yeah.
And when you stand up, or when you sit up, see when you sit up, 20, okay, so let's just talk about what's good. So when you sleep, you need the jugular vein to be open at least 7 millimeters by 7 millimeters. And when you stand up or sit up, it should be at least 5 by 5. So your right one meets all that criterion. So if I have a patient, you're obviously my patient, and you can see it's so different on the left side. See,
Yeah.
the left side, C1, C2, it's much less, 54. So this is 7 by 8 millimeters, and this one's only 4 by 4.
Oh.
Then sitting up, see how this is 5 by 5 at C1, C2, but this is only 5, so it's
That's
3 by
really
2.
a lot lower.
Yeah, so you can see that so in other words, if you said, what's the structural lesion that we have to get rid of, is we have to get rid of the constriction of your carotid sheath on the left side.
Mm-hmm.
So on the left side. So then let's see.
I get most of my pain starting on the left.
Okay,
as
so
well.
then what we'll do is we'll look at your cone beam CT scan too. We'll look at that too. Okay. Because if we look at this, we did a gazillion measurements of your left one, and none of them were like 80 or something. So see how there's definitely something going on in the left side. So let's just try to figure out what it is. Like, let's first try to figure out, because in other words, we rotated the head to the right, we rotated it to the left, we did a bunch of things, but there still was a constriction. So I got to try to figure out why that is.
Yeah.
Just open a little. There you go. Just keep going. Right, you're open.
You don't care for your.
I think my sheet is 20. That's okay. I'll try to. We'll see if it. I know it hurts. Okay, you're.
We just went to Whole Foods, got my treatment done. Dr. Hauser ended up doing some injections in my jaw right here, because most of my pain is on my left side, so I was a little blindsided by that, but I went through with it. It was good. After you get your injections, your head is like really stiff. You can't move it at all. It's pretty. Your neck. Yeah. What did I say? My head? Your neck is really stiff after. Pretty painful after you lay there on a heaty pad for a little bit and kind of recoup. But yeah, I'm pretty drained, so probably just gonna go back to the Airbnb and take a nap. So I just wanted to go over a couple things, since in the last video I was pretty loopy and out of it. So yeah, your neck is very stiff after you get your treatment for, depends on who you are. I'd say max up to like 5 days. I'm a pretty fast healer. I did have to take Tylenol last night. I was getting a pretty bad headache, from coming from my neck, and throbbing headache like I typically get. I wouldn't say that the treatment brings on headaches. This was actually the first time that I had gotten a pretty bad headache after a treatment, and this was my 7th one. Typically it actually feels really good to have my neck like really stiff and not being able to move very much, since I deal with the exact opposite. So I should be getting the typed up, written up results from my DMX. They actually measure, how much instability I have. But based off of what he kind of went over with the results, as far as I could understand, my carotid sheath on the left side, which is the carotid, the jugular, and the vagus nerve, they all run together. But on my left side, it doesn't seem to matter what position I'm in. It's basically constantly being pinched off, whereas compared to my right side, it's looking a lot better. So obviously, I think what's contributing to that is my instability in my C1 and C2. As you saw on the DMX, it goes out way more on the left side than it does on the right. So I think before I post this video, I'll try to wait for my results of the measurements and the results from the sleep study, so that you guys can get a better understanding about it all. If you do decide to go to Caring Medical, you have to make sure you have a chaperone go with you. As far as I know, they will not allow you to be alone as far as after the procedure, because you need a driver and someone to help take care of you. So that's why my mom went the day before me, because she was feeling better enough the second day to kind of, make me food or help me with things that I needed to be helped with. I'm just trying to think if there's any other, questions that I could answer for you guys. I think the purpose of him treating my jaw on the left side was to hopefully help with the pinching of, everything going on that side. It actually really didn't hurt much. I was like pretty high on the nitrous cells. I mean, I could feel it, and after I was like hard to open my jaw, but I mean, the next day I'm pretty fine. It was just kind of a lot of popping and cracking in my ear. Kind of sounds weird, but so yeah, if I think of any more questions or topics that I want to throw in, I'll go ahead and do it, but I'm pretty sure I've covered everything that I can think of for now. So yeah, see you guys later. Hello everyone, I've been back home for a couple weeks now. I finally got my email of my report for my recent DMX, so I just wanted to go over everything. So this was my first DMX. It was 7/13, and then I'm comparing it to basically a month later, and then my recent one in April. Okay, so I came in obviously with a very straight neck, which is something that hasn't changed yet because I have not taken it upon myself to do as much curve correction as I should have. So that is definitely on me. I really need to focus on that more. One thing I'm noticing that hasn't really changed too much is when I tilt my head forward, I still have spacing in between my vertebrae. So let's see, it started with, this was my first one, 2, 7, 2, 3, 2, 3, 2. So pretty bad up between C2 and C3. C2, C3 within a month later, it dropped down to 2, 3, 2, 3, 2, 3, 2. So that's it. The C2, C3 improved a lot within that time period, within a month, which was, I'd say about, maybe 4 treatments, I'd say, give or take. Okay, so then this is to me the most important one because this is where I'm still struggling. So when I tilt my head to the left ear to left shoulder, I have a 5.7 millimeter overhang basically of my C1 over C2. And within a month later, it went from 5.7 to 4.7. So that was just a big improvement in itself. And then we go over to the right, which was pretty bad, which is surprising because I get most of my pain on the left, but it's 7 millimeters hanging over that big pointy bone, basically impinging on my jugular and my vagus nerve and my carotid. So that's why I have extra pressure in my brain. But it went from 7 millimeters from my first treatment to 5.3 on a month later checkup. So that was a huge improvement. That was awesome. Really, really awesome. So, this is basically my very first diagnosis when I went to carrying cervical instability from the posterior longitudinal blood. I don't even know how to say these words. So basically my whole neck is unstable all the way down. Okay. Gapping. So the gapping, and then this is the top where it goes left to right. C1. Okay. Significant overhang of the lateral mass of C1. So, all right. So now let's compare my 8/13 to my most recent one that I've been blogging about. So there was a really big gap in between my treatments, which is not something, if you can avoid, would be better, because the closer you keep your treatments, the better your neck's going to hold just overall. So there was a pretty big gap. So about 6 months. So about half a year. I had family stuff going on, so we weren't able to go in. Anyway, my neck is obviously still really straight, so I need to really, really focus on that. So let's go right up into the, I noticed that this one is actually, a little bit worse, but before it was here, now it's just moving down my neck. So I'm not really sure. I think just if I really focus on getting my curve better, that should hopefully look better. So now let's go to the C1. So this is the left. So keep in mind, this is 6 months. 6 months after I think I got in between this treatment and then this one I'm showing you, I think I got at least one more treatment, but then the 6 months had passed. So this is pretty good. My neck's holding up good. So 4.7 to 4.4. So there's even an improvement in the 6 month gap. And then on the right, it was 5.3 to 4.1. So in the beginning, it went from, 7 all the way up to 4.1 now. So that's a huge, huge improvement that I'm seeing. It's really it's giving me hope that, if I continue this treatment, that hopefully in the long run, it will pay off. And I really need to focus on getting my curve back in my neck. I need to do my part in the treatment if I want to have, my neck not pinching and such. So hopefully in a moment, I'll be showing you guys the results from my sleep study. So I got my email for the IJV sleep study. I'm assuming the IJV stands for internal jugular vein. That's just what I think. Okay, so the normal cross-section area of the internal jugular vein in healthy adults measures in men generally over 100 millimeters square and in women over 80 millimeters in the supine position. So that's laying down. When a person moves from supine to an upright seated or standing position, the internal jugular vein do collapse, but still do stay open, somewhat open. So they get narrow when you stand up because I'm sure gravity and such. Okay, so it's a little bit confusing for me to understand, but for the most part, so 80 or above is normal for any supine position, right? And obviously it's going to close when I'm upright, so seated. So as we can see, I have on the right is a lot better than the left. I have normal, a little bit low. This one's pretty high. Okay. And then these are all the positions that I was in when that was measured. And the left is really low. And also when I'm seated or standing up, it's like extremely low. So that makes sense for like anyone with POTS. It's just so, intriguing and so when you stand up, your veins close, so that makes sense that you get lightheaded or dizzy. I definitely suffer from POTS, so the whole trifecta: EDS, mast cell, POTS. And then what I found was interesting was, so I can really use this to figure out which sleeping position is going to be better suited for me. Like I said, it's really hard for me to sleep on my back. I typically can't fall asleep on my back, but I'll sometimes wake up in the middle of the night and I'm on my back, so I don't consciously do it. So let's see, lying on the right side. So I'm laying on my right side, and my right is nice and open, but my left in flexion. So that's flexion. I think that's sticking your chin out and forward, and protraction is pulling your chin down toward your chest. So it actually gets really bad when I'm laying on the right side, probably because that bone is pushing up into my vein. I don't know. And then laying on the left side. So in general, laying on the left side is going to be a little bit better than laying on the right for my left. But look at that. It switches. So flexion is worse when I'm laying on the right, but protraction is worse when I'm laying on the left. So that's so interesting. So yeah, and then it gives you a little reference of kind of what they're talking about here. So yeah, it all kind of makes sense to me now. Some pre-Prolo tips. I have them all written down, so hopefully I won't need to ramble. Number 1, check your Airbnb or hotel to make sure the beds aren't hard as a rock. Because I don't know about you, but after you've been stabbed in the neck, the last thing you want to do is go lay down on an uncomfortable bed. Along with that, bring a comfortable pillow from home if you can fit it in your bag, because you will regret not bringing that. I have learned that the hard way. Another tip I have is don't book anything too far away from the clinic, in my opinion, because the car ride back is very uncomfortable. And there is a lot of traffic in Florida. So there is a hotel literally right behind the clinic we did stay at. The beds were horrible. So use your own discretion on that part. Make sure you have a chaperone or family member or friend that you can trust to go with you, who's going to support you through this whole process, help take care of you, make you food, be there when you need it. You need someone supportive and caring through your mission and procedure. Okay. It says shave those armpits. So if you're someone who's concerned about hair anywhere, make sure you shave before you get your neck treatment, because you are not able to move your head at all to look where you're shaving. So just a little tip. I'm sure if you're there getting stabbed in the neck, the last thing you care about is if your armpits are hairy, but you never know. Make sure you bring Tylenol or Advil or whatever you take. I can only take Tylenol because I have a stomach disease, so that's what I do. Heating pad is super, super important to lay on. You're not allowed to use ice after, because they actually want the inflammation to stay in your neck, because that's what's helping it heal. Okay, so no ice. Heating pad, don't go without it. Let's see. So make sure you have your food stocked prior, in your hotel, or have, your chaperone go out and do all that for you. Any comfy items you want to bring with you from home, like blankets or anything like that. So I think that's all the pre-tips. Let me see. Yeah. Okay. So day of treatment tips. So wearing a loose fitted shirt is important, because if you're getting treatment in your neck and they can't access your neck, you're going to have to wear a gown, which I don't like. I just like to wear, even something like this is probably fine. They can tape it back. So wear a nice, comfy, loose fitted shirt, or just comfy clothes in general. Typically after my treatment, I just fall asleep on the ride home and sleep for hours when I get home. So I'm already wearing something comfortable that I don't have to change. It's very hard to change your clothes. It's hard to wipe your own, what. So it's, yeah. Eat a good breakfast with protein. If you're doing the PRP, with your blood, you want to make sure you have nice, good, healthy blood in the morning. So eat your protein. If you have any pre-med that they ordered for you, make sure you bring that for your treatment, like your Xanax or whatever. Like you saw in the video, we do Xanax and the nitrous gas in combination with each other. The gas really helps a lot. Obviously it's an extra charge. So, again, use your discretion on that. Just remember to stay calm during your procedure. It really only lasts 15 minutes. So just remember that it's going to be pain for a short amount of time. Okay. Better in the long run than pain a lot of the time. That's how I see it. So post Prolo, relax, nap, take it easy. It's hard to change your clothes, let alone you're not going to be able to ride a bike or do anything like that. You're in Florida. I know it sucks. So your neck is super stiff. You're not going to be able to move for at least 2 to 3 days, depending on how fast you heal. And I would also suggest giving yourself a day or two before you plan on flying back or traveling back to your hometown. After you get your first procedure done, you'll have a better idea of how you're going to react or feel, or how much time you need, blah, 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 stuff like that. So yeah, everyone's different. Everyone's going to take, a certain amount of time to heal. Everyone's pain tolerance is different. So keep it all in mind. So I wanted to give you guys a little bit of a background about myself. I am 28. I started gymnastics when I was 4 years old. I was a high-level competitive gymnast for 12 years. I currently coach gymnastics. It's my hobby. It's my life. It's what brings purpose in my life for being here and being around. And so I started experiencing symptoms when I was probably around 20 to 21. It started in my chest. I had costochondritis, which is basically inflammation of the cartilage. My ribs were hurting really, really bad. And then it started to progress into my neck. I was in a handful of car accidents, which
obviously contributed to my neck being straight and just having neck problems in general. In 2018-ish, I was seeing a chiropractor. She was aware that I had Ehlers-Danlos syndrome. I was being manually adjusted. I went in with pretty bad neck pain, like my neck was really out. It was hard to move. It was kind of pinching and it was hurting. So I was looking forward to getting an adjustment because they would typically help. When she did the adjustment, it was immediate pain. It was shooting, stabbing, sharp pain, and it kind of felt hot, really hot. And it like hurt all the way up into my eyes. And I just knew right at that instant that it was not a good choice. That was on her end and on mine. Any chiropractor who is aware or knowledgeable about EDS knows that they have to be very, very careful if you're ever getting manually adjusted. Basically, from that point on, I was suffering from general constant neck pain for 3 or 4 years. It wouldn't get better. I'd say about 80% of the time, my neck was hurting. And it would progress into these horrible, I call them orthostatic headaches. Anytime I would move or stand up, anytime my blood pressure would change, it would cause horrible throbbing pain throughout my whole head, my eyesight. It was horrible. I was really suffering. And obviously I never went back to get manually adjusted again. I found an awesome chiropractor who it's called the Pro Adjuster. And I think they might have a website you can see which chiropractic offices offer that type of adjustment. So it's just a machine that lightly taps your vertebrae or whatever into alignment and into place. It's a lot more gentle. It's helped so much. I don't want to say that you're going to go into carrying and get 1 or 2 treatments and be completely healed and feel like a new person again. Although I hope that your story may be different than mine, and some people's may be a lot worse than mine. There's a lot more people who are way worse off than me, and I'm pretty bad with my neck. So my heart goes out to you all. It's definitely a process. You know, it's been almost a year since I first started seeing Dr. Hauser, and you know, some days I wake up and I'm still in horrible pain, and I just think like, is this working? Like, you know, I feel down on myself. I feel bad for myself. Like, why me? Why do I have to be hurting like this all the time? It's taken away so many passions in my life. I can't dance. I can't perform anymore. I can't do all of those things I used to be able to do. It's taken so much from me, emotionally and physically, as I'm sure you can all relate. But I look back a year ago and I was so much more worse off. I was missing up to a week at a time from work, from coaching, and I was just laying in bed. I was miserable. I was super depressed. And I just, you know, I would think like, there's no way that I could continue living my life in that amount of pain. My mom and I both found hope through Caring Medical, and I know that a lot of you, you know, may not have the funds to even dream about going to a place like that for treatment. So I really do feel fortunate that my mom and I have the funds to be able to do something like this. There was a post that a woman made stating that her insurance actually covered prolotherapy. I think she was in the state of Texas, but they do not accept insurance there, so everything is out of pocket, and it is very expensive. The treatments alone, but also, you know, the DMX and other diagnostic criteria that you may need are, you know, it's expensive. I'm not going to lie to you. And I know some of you may not ever be able to afford that, but I hope that maybe, you know, if you could somehow get a referral for a digital motion x-ray, that's going to give you so many more answers and ways for your doctor or, you know, physical therapist to help treat you. It's like, oh yeah, like I got diagnosed with Ehlers-Danlos. Like, in that 1 minute, I was like, that's awesome. Like, I finally have a diagnosis, shove it in those people's faces who were ever doubting you. Like, look, it's right here on paper. Okay, but now what? Now I have more questions, right? Okay, I have EDS. My joints don't stay in place. Okay. What now? Why do I have pain in my neck? What's going on in my neck? What's going on in my knee? What's going on in my body that is causing this pain? After I got that DMX, I just felt, there it all was. All the answers to why I was experiencing my pain. And there's still some unsolved, like with it, the last thing that's going to heal is the major instability in the top of my neck, which I'm still dealing with now. So it's just, and I need to work on my neck weight. I need to correct that curve. And it's a process, and if you go in maybe with a better curve than me and start treatment out like that, you're going to have a better outcome faster than someone who comes in with a horrible straight neck or has had the symptoms for longer than maybe I have, which I've been about 4 years, which isn't very long. My mom is 20 years older than me. She's like 48 or something, and she's been dealing with this for 20 years. Medical gaslighting, mismanagement. She's been through so much, and I'm thankful that she has led the path easier for me to be diagnosed. And I don't have to go through it alone. I know it sounds kind of shitty, but it's like I have someone else to talk to about how fucking awful and shitty I feel all the time because she can relate to me. So it's just kind of funny. But this blog was really made for educational purposes, hopefully to inspire some of you that there is hope out there. There is treatments that may possibly help you. It may not help everyone. But it's sure as hell worth a shot, in my opinion. So I hope that you found good information in this video and that that you are never alone in your fight to recover or just to feel better in general, just to have one day of relief. So my heart goes out to you guys. If you have any questions, go ahead and you can message me directly with any questions you have. So best of luck to you all.